Have you ever been to the doctors? I'm assuming the majority of you have or will have to. According to my research, 82.1% of adults and 92.8% of children have needed to consult a healthcare professional in the past year. In order for doctors' offices and hospitals to run, they need nurses. I've done plenty of research on the current projected nurse shortage. Currently, more than 50% of our nursing workforce is close to retirement age. As the baby boomers age, the nurse shortages are projected to intensify as the need for healthcare continues to grow. Today, I will be telling you about the current nurse projected shortage, the rising need for healthcare, and the current projected job growth rates for nurses in the coming years. To begin, I will be telling you about the current projected nurse shortage. According to the United States Registered Nurse Workforce Report Card and Shortage Forecast, published in January 2012 issue of the American Journal of Medical Quality, a shortage of registered nurses is projected to spread across the United States from 2009 to 2030. Nursing schools around the country are struggling to expand the capacity to meet the demands. The AACN, or the American Association of Colleges of Nursing, are working with policymakers, nursing organizations, and schools to get the attention to inform people on this healthcare concern. The AACN is also using its resources to identify strategies and form collaborations to address this problem. The aging nursing workforce is one cause of the nurse shortage. As I stated before, more than 50% of our nursing workforce is close to retirement age, with the median age being 46. With this being said, the more nurses that retire, the more nurses that we need. It is important for people to understand these facts because when they do, we can do something to change them. So, we have briefly touched on the reasons why there is a projected nurse shortage. Now let's talk about the rising need for healthcare and how it impacts this nursing shortage. Though the AACN in a data report reported a 2.6% enrollment increase in the entry-level bachelorette program in nursing in 2013, this increase is not sufficient enough to meet the projected demand for nursing services. With the Patient Protection and the Affordable Care Act in 2010, more than 32 Americans will soon gain access to health care. As we learned, many of our nurses are close to the retirement age, meaning a problem will arise if more people are gaining access to health care and there will be less nurses available. As the baby boomer age, America is seeing a vast increase of people over the age of 65. This age group of people has a demanding medical needs and can put a strain on our healthcare system. Reforms in healthcare such as the Affordable Act will give millions of people access to health care. 2 to 3 million additional patients each year will enter Medicaid, says Peter McMadden, a senior policy fellow and health economist at the American Nurse Association. There are already 8 million people signed up through the Affordable Care Act. As you can see, the number of people gaining health care is increasing tremendously. With this increase in health care, an increase in nurses is expected. Now that we have learned about the reasons causing the nurse shortage, next I'm going to tell you about the projection of job growth rates for nurses. According to the Bureau of Labor Statistics, employment projections from 2012 to 2022, released in December 2013, registered nursing is listed among the top occupations in terms of job growth rates from and through 2022. The RN workforce is projected to grow from 2.71 million all the way to 3.2 million in 2022, an increase of 19%. Recent recessions made it harder for nurses to gain work. This means that more nurses have kept their jobs and experienced nurses have put off retirement. The Bureau also projects 525,000 replacement nurses in the workforce. More than half of our nurses are close to retirement age, which is why we needed increases for nurses. In closing, nurse shortages have been a topic for years now. Currently, they have become a bigger topic due to the fact that as the baby boomers age, nurse shortages are projected to grow. All the while, healthcare needs are still continuing to rise. It is important to be aware and educated on this problem because it can affect you or somebody that you know. Projected job growth rates for nurses affect projected nurse shortages, which is important because healthcare needs are still continuing to grow. Always remember, there's a nurse present at every doctor's appointment that you go to.